Good afternoon, everyone.
Good afternoon.
My name is Dr. Kendall Griffith, and I am the Interim Chief Executive Officer of the Governor Juan F. Louis Hospital and Medical Center. At this press conference, I am joined by our Chief Medical Officer, Dr. Mavis Matthew, Mr. Michael Younger, our Assistant Chief Financial Officer, Ms. Hazel Filbert Thomas, our Vice President of Quality. We have Ms. Eleanor Paul O'Neill, who is serving as our Vice President of Human Resources. We have Ms. Jacinta Stevens to my left, who is representing our Chief Nursing Officer. On Wednesday, September 17th, I received a letter from the Centers for Medicare and Medicaid Services, CMS. But the agency informed me in that letter that the Governor Juan F. Louis Hospital and Medical Center will no longer qualify to participate in this Medicare and Medicaid program beginning October 9th, 2014. I immediately contacted Governor John DeYoung, Delegate Christensen, Senate President Malone, our District Board Chair, our Territorial Board Chair, and other members of the legislature to inform them of the letter's content. I also called an emergency executive meeting with my executive team to inform them of CMS's decision, and we immediately began to formulate a strategy to address this issue. My executive team and I have since continued our discussions with the Office of the Governor, the legislature, delegate to Congress, and all of the local government officials whose agencies are directly tied or impacted by this matter. The discussions in our meetings have centered on two very specific topics: JFL's response and appeal of CMS's decision to decertify the hospital, and most importantly, to ensure our operations and health services to the people of St. Croix are in no way interrupted based on our mandate of providing the very best and quality care to them. As Interim Chief Executive Officer of this hospital, I can assure the people of St. Croix that JFL, with the support of our District Board, our Territorial Board, Executive Branch, and Legislature, will leave no stone unturned in doing whatever is necessary to appeal CMS's decision to regain certification of the hospital in the most timely manner. I would also like to assure the people of St. Croix that in my capacity as Interim Chief Executive Officer, I can honestly say that the decision to decertify JFL is not a true or accurate picture of the hospital's current operating conditions, and it is certainly not reflective of the hard work and dedication I have witnessed from the staff and physicians on a daily basis. We were informed that a new hospital-wide survey was being conducted during CMS's last visit and would only reflect events that occurred from July 28, 2014 to August 1st, 2014. The report includes an accumulation of events from 2011 to 2014. Thus, there is no justification for decertification, and we will appeal this decision. We have all known for many years that JFL is not a perfect hospital. We all know, and it is well documented, that JFL has suffered through some very serious financial and staffing challenges throughout our history. These challenges, and as well as the others we face, are consistent with any hospital across the country. As a matter of fact, you will not find a hospital anywhere in the United States that has not experienced these same challenges at some point in time. But I also know, and I'm very proud to say, that everyone at JFL has been working diligently and tirelessly to meet or exceed all of CMS's standards for participation in their Medicare and Medicaid program, and the evidence is here to prove that we have made substantial and significant improvements over the past year despite our financial challenges. One of the very first things my executive team and I put in place when I assumed the leadership role at JFL was a plan to get the hospital fully certified by CMS. Over the past 2 years, and most specifically in 2014, we have worked our plan in conjunction with the efforts made by the executive branch and the legislative branch to fund our operations, and I would like to publicly thank these two branches of government for all that they have done for JFL in the past, and for the support they will continue to provide the hospital right now and into the future. Our journey to this point has not been easy, and although CMS has made a decision to decertify JFL, we have accomplished many things in our plan of action, and I would like to share some of those with you. When I assumed the role of the interim chief executive officer in January of 2013, we were faced with many challenges. Low employee morale, a failing physical plant, unresolved environment of care issues, significant levels of distrust, internal conflicts, inadequately trained staff, insufficient clinical and medical staff, a decline in government appropriations, conflict amongst physicians, lack of equipment and supplies to perform surgeries, patients abandoned by their families, death in excess of $40 million, long wait times and overcrowding in the emergency room, and a plan of correction to CMS that had been rejected twice. In the operating room, and dietary had no managers, and as we all know, the operating room was in a state of disarray. So first, we had to look at this matter to restoring JFL to its full potential in 3 phases. Phase 1 was to ensure stabilization. Phase 2 was to be able to sustain those changes that brought the stability. And stage 3 was to grow. So last year, spring of 2013, we submitted an acceptable plan of correction to CMS. We redesigned and enhanced our quality assessment performance improvement program. We created performance improvement teams to evaluate processes within high priority areas, fostered a culture of quality and safety through quality assurance initiatives, and we addressed our environment of care and life safety issues by upgrading. We stopped the financial bleeding. We broke down and are in the process of restructuring our financial team. And as you have heard in the past few weeks, we have seen a significant increase in our revenues and our collections every month beginning from June. I'm proud to say that in April of 2014, cash collections for the month was at $2 million. By August of 2014, our cash collections had increased to $4.2 million. And presently, we are on track for another $4 million this month. We have lobbied the government's stakeholders for financial assistance. They were able to help us through a very difficult summer. We right-sized our staffing levels, reviewed and eliminated certain contracted services, conducted an internal assessment of JFL's revenue cycle, and contracted the advisory board, a financial consulting company, to further assess and optimize these processes. To further stabilize the organization, we upgraded and still are in the process of upgrading our IT infrastructure. We evaluated our entire system and hired consultants to address multifaceted hospital-specific IT infrastructure issues. We utilized the Department of Interior TAP grant funds to equip and place a computer at every bedside to enhance clinical documentation. We provided resources and training in order for staff to perform their duties efficiently. We partnered with other agencies to train staff in performance improvement, customer service, emergency management, and leadership. We developed enterprise-wide process improvement projects to identify and eliminate waste, streamline inventory control, and increase revenue. We involve our community stakeholders through volunteerism and partnerships. And we are not only relying on government assistance, but we have also been looking to our stakeholders in the community for assisting us financially with different projects in JFL. We were able to reinstitute hospital-based community initiatives to increase awareness of hospital services, and created partnerships with on and off-island educational and healthcare organizations. We transformed the organizational culture. We cultivated the continuous sharing of the hospital's mission, vision, and core values. We re-engaged the staff through leadership and staff meetings, and fostered a culture of continuous process improvement. And one of those process improvement tools we used was the Six Sigma program. And I'm proud to say that we have trained over 150 employees in the process of Six Sigma. We were able to achieve successes and sustain successes while JFL has been going through these difficult times. The Joint Commission accreditation for the laboratory was recently renewed this year. The U.S. Food and Drug Administration laboratory blood bank was reaccredited. We received reaccreditation from the FDA for radiology and mammography. We had a successful OSHA inspection. We had a successful U.S. Nuclear Regulatory Commission inspection in the radiology department. We had a comprehensive review and management of all hospital policies, environment of care upgrades including routine rounding and repairs. We reduced overcrowding and patient wait times in the emergency department, and we were able to install a new fully functional fire suppression system. We were able to forge interagency partnerships. We formed a partnership with Victima and the VA Department of Health in the emergency management preparedness projects. With the National Guard, we had joint exercises and developed a memorandum of understanding for clinical rotations. We developed relationship with the VI Department of Human Services, the Public Employees Relations Board, the VI Department of Health, where we had lectures on chikungunya awareness as well as HIV/AIDS collaboration. With the University of the Virgin Islands, JFL's 3 pillars of leadership, the governing board, the medical staff, and the executive management team, has pledged support to the UVI Medical School project. And we have memoranda of understanding with various off-island healthcare and educational institutions. As far as community engagement and outreach, JFL contracts with the NRC PICR to conduct our independent patient satisfaction surveys. And we have instituted hospital-based volunteer programs, the Candy Stripers, the Community Volunteer Program, Patient Family Council, Guiding Girls Career Fair, Heart Health Day, on-the-job training for high school students, School to Work. And we implemented a case management care coordination program. We have revised the medical staff peer review process to ensure medical staff accountability and decrease potential for conflicts. We hired an OR and dietary managers who have implemented best practices in each of these departments, and both of them are functioning extremely well. We developed enterprise-wide process improvement projects, which has led to streamlined inventory control and increased revenue. The list goes on. While I'm very proud of the accomplishments we have made over the past 2 years, I am still very humbled by CMS's decision and the fact that our hospital was deemed deficient in several areas of participation. Certification under CMS is a must and priority for this hospital, and it is our responsibility to do whatever is necessary to achieve this goal. As such, I do not intend to let this decision demoralize the will of our people, nor will I allow it to demoralize the will and determination of our staff and physicians. JFL must succeed in meeting certification, and I firmly remain committed to doing whatever is necessary within the limits of my authority to get the job done. In closing, I would like to publicly thank all of our patients who have had the trust and confidence to allow JFL staff and physicians to care for your medical needs, and for your willingness to share positive experiences you have experienced at JFL with the community. More importantly, I would like to thank my executive team, as well as every staff member and every physician at JFL for their dedication and commitment throughout these very trying times. However, this is just another chapter in the history of this hospital, and it is our collective responsibility to ensure the chapter has one positive ending: full and complete certification by CMS. I'm extremely proud of you and what we have been able to accomplish for JFL, and I will continue to work alongside you through these difficult times. Our vision for JFL remains the same, and that it is to be the best hospital in the Caribbean. Finally, I would like to thank Governor John P. DeYoung and the staff, the members of the 30th Legislature, the delegates of Congress, JFL's District Governing Board, and the Territorial Board for the continued support and commitment both now and prior to this decision by CMS. I and my executive team will continue our collaboration with all of you in a united front to ensure there is continuity of all operations at the hospital, and that the people of St. Croix continue receiving the very best in quality care. I'm also very thankful for the media outlets who have joined us here today to provide the necessary news coverage to keep our citizens informed. This is a trying time not just for JFL, but for all of us, and we are in need of your full support, and most importantly, your prayers as we navigate our way through this crisis. We are Virgin Islanders and people of faith. Therefore, I ask that you keep every one of us at this hospital in your prayers as we continue to work on your behalf to immediately regain recertification in CMS's Medicare and Medicaid program. Thank you. I am now prepared to take questions.